Hello everyone and welcome back to my YouTube channel. My name is Camille. I'm a first-year medical student as well as a registered nurse, and today I wanted to make a quick video about the reasons that I personally decided to go MD compared to going to NP or CRNA school. So without further ado, let's get started. Alright, so before we get started, I really just wanted to say that nothing in this video is intended to belittle, talk down upon, say anything negative about nurse practitioner, NPs, or certified registered nurse anesthetists, CRNAs. I've worked with both NPs and CRNAs in the past very closely. They are very important to the functioning of the healthcare system. They're very good at what they do, very knowledgeable providers, and really without them, a lot of things would be way harder, way more challenging, and they really do help provide a backbone for the healthcare system, okay? So this video is really just intended to go over the three reasons that I personally wanted to do MD compared to NP and CRNA and not say anything bad about either of those other specialties, okay? So really getting into the first reason that I decided to do MD compared to NP or CRNA was practice limitations, okay? Independent practice. So if you're a nurse practitioner or CRNA, you have to have a physician sign off on your orders, on your notes, and anything else that you kind of want to do for a patient, right? So you need to have that physician oversight, whether that's an MD or DO signing off on them, but you still need that oversight of a physician. Some people will say, oh, well, that's not true because in the state that I practice, I can practice independently as an NP, or in this clinic that I work at, I don't need a physician to sign off on my work. However, again, I don't want to be limited into where I can live or where I can work just based off of being able to practice independently as a provider, okay? So that was really my first reason. And then going on to my next reason was really about the training process itself. So from the nurse practitioner schools specifically that I've looked at, a lot of them only had a 500-hour clinical requirement, which may seem like a lot to some. To me, it did not seem like enough time for me personally to feel comfortable to then go out, find a job and practice semi-independently, right? You still need that physician oversight, but you really are making the decisions, talking with patients, writing your notes, and the doctor just quickly reads over them, makes sure that everything is up to his par, and then signs off on them, right? But you still really do hold a lot of responsibility. So for me, only being a nurse for a couple of years, I did not feel that that was a good next step, just personally speaking, right? So that's kind of why I decided to go the MD route again, was you do have, of course, it's a much longer process, right? Here, you're looking at 4 years of medical school plus residency. So it is a much longer process, but I do like the idea that you have those extra years after medical school to be able to practice really very closely with other physicians, kind of like on the job training, and perfect your practice before then finding a job as an attending and being completely independent, right? So that was my second reason that I wanted to do MD over NP or CRNA. And really the last reason, which was really important for me, was if I wanted to specialize in something surgical or procedural, I wanted to be actually able to do the procedures, do the surgeries, something that NPs and CRNAs really don't have the opportunity to do. Yes, some NPs scrub in as a first assist, and they can work for a surgeon, or CRNAs work with really on par with anesthesiologists. They do procedures, central line insertions, things of that nature, and they really do provide the anesthesia care for the duration of the cases usually, and just have that physician oversight if they need it, right? However, again, if I want to do something surgical or do surgery, that was a big reason, a big push for me to go to medical school, right? So again, I'm still a first year and I'm deciding. Interventional radiology really is up there on my list. However, my decision can always change. I'm still very early in my practice. Nevertheless, I wanted to have all the options open to me regarding what specialty I want to choose, especially those surgical specialties, right? That I wanted to practice in. So that was really the third reason. And then really quickly, a last reason, kind of not reason for me to go into MD compared to NP or CRNA was really, I am pretty young still. And it was always a dream of mine to be a physician, right? I was kind of waxing and waning, but that thought has always been there. And I think I'd be kicking myself if I didn't at least try. So that was like another reason of mine, right? I'm still young. I still have a lot of years of life ahead of me. Not to say that, I have plenty of students in my medical school class now that are, a little bit older. None of them are old. Everyone is still fairly young, but, a little bit later on in life where they already have a wife and a kids and family and, different responsibilities, and they're going back to school. So it never is too late to start school. But I think that kind of helped also push me towards MD because I didn't have those responsibilities, if that makes sense, right? There really was nothing holding me back, such as, a family or having to worry about the finances that come with going back to school and trying to support your wife and kids and, have a house and all these other finances that, of course, you have to take into consideration if you do want to change your career or go further on into school. So that was kind of my fourth reason. And those are the main four reasons that I had going through my mind, really wanting to do MD versus NP or CRNA. So that's all I have for you guys today. I hope you enjoyed the video. It wasn't too long of one. If you have any questions, please leave them down in the comments below. Don't forget to give this video a thumbs up, hit that subscribe button, and I will see you next time.